Hey guys, if you haven't heard about Anchor by Spotify, it's simply the easiest way to make a podcast. Anchor by Spotify has everything you need all in one place. So let me explain. Now, Anchor has tools that allow you to record and edit your podcast right from your own cell phone or your own computer. Now, I've been using and loving Anchor by Spotify for 2 years now. And don't forget that Anchor will go ahead and distribute your podcast on so many listening platforms like Spotify and Apple Podcasts, and so many, many more. Now, I think it's simply everything you need to make your own podcast, all in one place. And don't forget, Anchor is totally free. So why don't you go ahead and download the Anchor app or go to anchor.fm to get started. I can't wait to hear all of your podcasts. Hey everyone, welcome back to all my listeners. Now I hope everyone's having a great day so far. I know I am. And if it's your first time finding me, thanks so much and welcome. Welcome to episode 16 of season 6. Today is Wednesday, August 17th, 2022. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, all right, you guys, as I'm sitting and recording this episode today, it is a bright and sunny summer day. I know I am simply enjoying every moment while I can, even if it's from inside recording a podcast. But you know how much I love recording my podcasts. I love delivering all of this valuable content to all of my listeners each and every week. So thank you all for all of your continued support time and time again, even in the weekends when you're catching up and binge listening. So thanks so much. I see you all doing it. So thank you. Thank you, you guys. Now, today I'm going to try and record a slightly shorter episode if I can, simply because I am feeling myself getting a cold coming on. Hope it's not the COVID. I hope it's not the COVID. But hopefully I can keep this a little bit shorter and sweeter. So I've got a little bit of news and a little bit of compliance tips to dive into for all of us. So in today's compliance tip, I'm going to try and get us all back to basics with the CERT program. And today's Newsworthy is going to be featuring the new CLIA-waived tests that take effect on October 1st, 2022. That's just around the corner. And I'm going to go ahead and try and close out today's episode with some inspirational words on vision and leadership from Anne Sweeney. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help all of your providers paint the medical picture. If you like what you're hearing, please go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and my recommendations based on my over 12 years of experience in front office, in back end, in coding, and in billing for multi-specialty physicians, in compliance, and in auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy. There are recent developments for providers billing Medicare administrative contractors, the MACs, for clinical laboratory improvement amendments, or CLIA-waived laboratory tests that they provide to their Medicare patients. Now, there are some things that you need to make sure that your billing staff knows about these changes. So, what are the CLIA requirements? There are new CLIA-waived tests that have been approved by the FDA, and your billing staff need to understand that they have to continue applying and appending the modifier QW for these CLIA-waived tests. Now, let's go over some background fun facts. I think they're fun. All right, now CLIA regulations require a facility to be appropriately certified for each test they do. Now, this is my fun facts that I provided here. There are 5 levels of CLIA certification, so let's be mindful of these 5. The first one is the Certificate of Waiver. Now, this particular CLIA certificate is issued to a laboratory to perform only waived tests. And again, those are those ones only with the modifier QW. Then the second CLIA certification is the Certificate for Provider Performed Microscopy Procedures, or PPMP. Now, this particular certificate is issued to a laboratory in which the physician or the mid-level practitioner or the dentist performs no tests other than the microscopy procedures. This certificate permits the laboratory to also perform waived tests. Again, those CLIA-waived tests with the modifier QW. And then the third CLIA certification level is for the Certificate of Registration. Now, this particular certificate is used for a laboratory that enables the entity to conduct moderate or high complexity laboratory testing, or both, until the entity is determined by a survey to be in compliance with CLIA regulations. So again, that was the third, and it was called the Certificate of Registration. Let's move on to the fourth CLIA certification. The fourth one is known as the Certificate of Compliance. This certificate is issued to a laboratory after an inspection that finds the laboratory to be in compliance with all applicable CLIA requirements. And the final fifth certificate is known as the Certificate of Accreditation. This is a certificate that is issued to a laboratory on the basis of the laboratory's accreditation by an accreditation organization approved by CMS. Now, let's move on to the newsworthy CLIAs, right? Now, CMS edits laboratory claims, right, at the CLIA certificate level that I just went over to make sure that Medicare and Medicaid only pay for laboratory tests in a facility with a valid current CLIA certificate. Now, since these tests are marketed immediately after their approval, CMS tells all of the MACs in the country of these new tests so that they can, on their internal end, process claims accurately. So if they have to develop edits at play, anything like that, that can be conducted well beforehand, well before the CPT codes can become effective. Now, speaking of, there are 8 new added waived complexity tests that I'm going to go over. Now, these new tests, again, must have the modifier QW to be recognized as a waived test. Now, the HCPCS code, effective date, and description for these latest tests are: number 1, CPT code 87651, again with the modifier QW appended to it, is from Mesa Biotech Acula, and it is a Acula Strep A test. And it was effective on November 9th, 2020. The second HCPCS code is G0475, again with the modifier QW. It was effective February 7th, 2022 by Abbott Diagnostics to determine HIV. It's a combo fingerstick, whole blood. And then the third HCPCS code is a CPT code 80305 with, again, the modifier QW appended to it, was effective on March 1st, 2022, and it was produced by Noble Medical Inc., and it's a dip card drug test cup. And there is also CPT code 82456QW, which was effective on March 25th, 2022, and that is for a PTS panel's cholesterol testing strips. And that was the fourth CPT code. I apologize. The fifth CPT code is 82010 with the modifier QW, as well as CPT code 82962. And these were both developed on April 7th, 2022 by Apex Biotechnology Corp. And this is for a blood glucose and ketone monitoring system. And then the sixth CPT code is for 80305 with the modifier QW appended to it. And its effective date was May 9th, 2022, It was developed by T&D Diagnostics Canada Private Limited, and it is for a multi-drug test in a cup or a dip card. And the seventh new CLIA-waived test has a CPT code of 80305 with the modifier QW appended to it. Its effective date was June 1st, 2022. It was developed by Next Screen Gen 2, and it's a multi-drug urine test cup. And the eighth and final CLIA-waived test's CPT code is CPT code 80305 with the modifier QW appended to it. It also was effective on June 1st, 2022, also made by Next Screen Gen 2, but it's a multi-drug urine test dip card. Now, also newsworthy to note, I think, are these additional HCPCS CPT codes of 81002, 81025, 82270, 82272, 82962, 83026, 84830, 85013, and 85651. All of these particular CPT codes do not require a QW modifier to be recognized as a waived tests. So these are the exceptions. These particular CPT codes I just mentioned actually do not need the modifier QW. And now it's time for my best practice tips in Trusty Tip. So in today's new Back to Basics compliance tip, I wanted to focus on the CERT program. Now, CMS created the Comprehensive Error Rate Testing, or CERT, program to measure the rate of improper fee-for-service payments. Now, the error rate measures payments that did not quite meet Medicare requirements, and it does not indicate fraud. Now, how does the CERT program work? Well, the CERT contractor or a team of contractors are going to be reviewing a sample of processed claims. Now, if that claim does not meet Medicare's coverage or coding or billing rules, or the provider simply fails to submit requested medical records that accompany all of those claims, it's counted as a total or partial improper payment. Now, Medicare administrative contractors, the MACs, analyze CERT error rates to reduce the improper payments by updating their internal processes and educating providers. Now, effective August 11th of 2020, CMS resumed or turned back on the Comprehensive Error Rate Testing program. That CERT program turned back on. We had some breathing room temporarily, right, because of the response to the PHE, the public health emergency, because so much staff at CMS also had to stay home, right? Offices were closed temporarily. So this particular CERT program was also closed for a few months. But like I just stated, they did up and resume on August 11th of 2020. Now, due to the cyclical nature of the CERT program's improper payment measurement and the statutory timeline that's required for improper payment reporting under the Payment Integrity Information Act of 2019, which means they have to report annually, the improper payment measurements cannot pause for such an overextended period without missing the statutorily required due dates. So then and therefore, because of this PHE, the CMS adjusted the CERT program data collection by reducing the sample size for the reporting year of 2021 and the reporting year of 2022 to account for the multiple challenges incurred by all of us, right? Providers, suppliers, everybody, CMS, everybody during the PHE, while continuing to maintain appropriate accountability measures and meet statutory obligations. Now, claims with dates of service within the COVID-19 PHE were reviewed in accordance with all applicable CMS waivers and flexibilities. Thank goodness. Now, the CERT documentation requests identify that the requested documents are to be submitted within a deadline frame of 45 calendar days of the request. Now, however, the CERT program has the discretion to grant extensions to providers and suppliers who need more time to comply with the request. So that's a wonderful thing. They will allow for an extension if you ask for it and state your reason why. Now, providers and suppliers should contact the CERT Documentation Center customer service to identify any hardships or any additional time that's needed when responding to a CERT documentation request letter, sort of like an ADR letter, right? So always ask. Now, the CMS estimates that the Medicare fee-for-service program improper payment rate through the Comprehensive Error Rate Testing, or CERT program, right? That's what they do. Each year, the CERT program reviews a statistically valid stratified random sample of Medicare fee-for-service claims to determine if they were paid properly under Medicare coverage, coding, and payment rules. Now, the fiscal year of 2021 Medicare fee-for-service estimated improper payment rate is 6.26%, which represents $25.3 billion in improper payments. And when I reviewed the accompanying chart, I found it particular to note for the providers that I've had to work with over all of these years. Part B providers came in with an improper payment rate percentage of 8.49%. So, wow. And that total of improper payment monies is $8.5 billion. And then even larger in terms of improper payment error percentage is that 28.64% error rate for our DME, for all of our durable medical equipment, prosthetics, orthotics, and supplies. And then their grand total overpayment amount is $2.38 billion. So those are overpayments, improper payments. Those, regardless, are big numbers, regardless. Wow. Now, all public reports produced by the CERT program are available through the CERT Reports link. So you just have to go to their webpage, and there will be a link there provided, and you have access to it. It's a public report. Now, the improper payment rate is released annually in the Department of the Health and Human Services Agency. Of course, that's HHS's Agency Financial Report, the AFR. So, you know what? The CERT program, as I read this and processed it while I'm talking to all of you, it's yet another program integrity program, right? That's going to be assessing, again, the overall improper payments or overpayments, right? And when that kind of analysis is involved, I really do think that the CERT program can also always kick you over elsewhere, right? Back for more investigation if you don't send your supporting medical documentation on time at their request. So I do think that they have that ability to kick you over, to be looked into further if you're not complying with their request to send over that coordinating documentation to analyze alongside the claims that they already have within their system. So I really do think it's completely fundamental, if you have Medicare as a payer, to keep your eye on compliant coding and billing practices. Make sure that you're adhering to all of them. Make sure that you're meeting the medical necessity from the very start. Because when the documentation paints the medical picture with clarity and vibrancy from the onset of care, a certified medical coder can then abstract codes with accuracy. And finally, I focus Season 6's Spark on vision and leadership. I want this 6th season Spark to be filled with the world's thought leaders, writers, artists, philosophers, everyone who inspires the need for vision and leadership in all we strive to do. So, in this week's inspiring quote in Spark is from Anne Sweeney. Define success on your own terms. Achieve it by your own rules, and build a life you're proud to live. Absolutely true, right? I think this quote inspires us. It reminds us that we all can view success differently. I think we all have the right to work hard, to keep learning, to keep growing every day for our success. It's important to remember that a happy and healthy life is a successful life. This quote reminds us that we all have the ability to look proudly at the life being built, at the life we are creating. This quote inspires us to allow our achievements to be celebrated and to learn from our mistakes. I am happy Anne Sweeney's spark still burns brightly in all of us today. So that wraps up today's episode. And as always, I appreciate you all diving into today with me. If you want more information from me, please go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Now, all right, you guys, I hope you're all literally enjoying the last lazy days of summer while you can. Oh my goodness. I hope you're enjoying yourselves. Time flies so quickly. So anyways, you guys, please have an amazing week ahead and please try to stay safe and healthy. I know I've caught a cold or a cough from someone. My kid had a vapid cough for about 2 weeks. So maybe I'm finally getting that. There's been COVID in this neighborhood where I am. So it could be from anywhere. But anyways, you guys, please try and continue staying safe and healthy as well. Thank you so much for listening in on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.